welcome all you guys. This is Neha Ranglani and we have with us someone like I like to call her the Pandora of knowledge, Neha Ranglani in the house. She's a health, lifestyle, nutrition educator, everything basically. And today we're going to talk about something which is I think a very gripping issue and something which has become very common these days. We're going to talk about blood pressure. So first up, tell me, where did the whole concept of this blood pressure come out? And you know, I'm hearing a lot of these youngsters complaining about blood pressure. So where did it come out from? Like,
so, you know, as the name suggests, blood pressure is the pressure of the blood on your heart.
yeah.
It's just the name suggests, you know. I mean, our heart has to go through a lot of pressure to pump the blood throughout the body. And why that happens is because of our liver. So what happens is, you know, just imagine you're sipping water through a straw, how easy it is.
Yeah.
Very easy. Then if you have to sip milkshake through a straw, little difficult.
Yeah.
And say you have to sip a pudding through a straw. How difficult is that gonna get? Yeah?
Yeah.
So just like that, you know, when the food that we eat, it goes into our gut, it gets broken down and it's then taken to the liver to get processed. But the kind of food that we are eating today is not food many a times. It's a lot of chemicals, it's a lot of preservatives, it's a lot of crap that we are putting in, and all of that goes into the liver. Now the liver has to do its job of filtering the blood so that the good blood can go to the body, it can go to the heart and from the heart to the body.
Yeah.
But with all the debris and all the bad, you know, things that are there in the liver, all the toxins you know, we are ingesting, the high fat diet, lot of chemicals, lot of preservatives, lot of pesticides, you know, all these things which are there inside us makes it difficult for the heart to actually pump blood from the liver.
Okay.
And that's where the blood has to, like, you know, use a very heavy force and pressure to suction the blood from the liver so that it can transport it to the body, and that causes high blood pressure.
Oh my
That's
God.
where the high blood pressure comes in. When you say a lot of young people have blood pressure, a lot of young people also eat a lot of wrong foods.
Yeah.
There's a lot of stress. It's not only the wrong food, it's also the stress that we go through. Because our adrenaline, which is a stress hormone, is very, very corrosive. It's very, very acidic. So our liver kind of is very loving to us. Our liver wants to protect us all the time. So it doesn't want that acidic adrenaline to damage all the other organs. So it absorbs the adrenaline and stores it so that our other organs are not damaged. And in that sense, again, the liver gets sluggish and toxic and the blood becomes thicker, it's less oxygenated, there's less hydration in our blood, it's dehydrated, because of which the high blood pressure.
So tell me something, how does medication work and is it the only way to get rid of BP or to tackle BP?
In fact, no. I feel medication for lifestyle disorders is the worst thing that you can do to yourself.
Okay.
Like blood pressure is a lifestyle disorder. It's a combination of bad eating and a lot of stress. So what I would say is medication for acute problems is fine, but not for chronic problems like blood pressure, diabetes, thyroid. That's not what is the best source of treatment.
Okay.
So BP medications do more harm than any good to your body. They either dehydrate you, so what they do is, there are different types of BP medications. So some, what they do, they kind of increase your urination so that there's less blood volume and there's less pressure on the heart. But that's not a good thing, right? It's dehydrating. The other kinds, what they do is they dilate your blood vessels and they kind of open up your blood vessels to relax them so that the blood can pass. But that's again an additional stress on the blood vessels. It's changing their structure in a way which is not natural. So the idea is that don't take something for another problem. Like, don't trade one problem for the other. So taking a medication is like trading one problem for the other. Now these BP medications cause more damage to your gut. They change your gut microflora. All medications, they change your gut microflora. There's more bad bacteria than good bacteria. You get a lot of gas, bloating, constipation, indigestion, cold, cough. Your immunity goes low because again the body is dealing with the medication, which is a chemical. Yeah. So what I suggest is, you know, you should make lifestyle changes if you want to treat a lifestyle disorder.
Okay. So you know, usually it is believed that अच्छा मुझे BP हो गया है तो मतलब it's a lifelong problem and I'm never going to get rid of. That's the, I think, mindset that each one of us have. So do you think that BP can be reversed?
Yeah.
You know?
Yeah, absolutely. BP is absolutely reversible. The minute you start eating correct and you start taking care of your lifestyle, your blood pressure will start coming down without medications. So here I'm not saying that somebody who's on medications already needs to stop it immediately because the body will get a shock. But yeah, you need to take care of your food and of your lifestyle in a way that your blood pressure starts coming down, so does your medication, and then you can wean off yourself from the medication.
Also, how would you suggest one person to tackle BP? You know, what should be the lifestyle changes that one should be making in order to like getting rid of BP?
So if you want to really reduce your blood pressure, you have to look at it from the liver's perspective. So basically, not a very high fat diet. What I would suggest is go low on excess fat.
Okay.
So excess fat, I mean refined oils, I mean animal protein. So animal protein we think is high protein, but it's actually high fat because you really can't skin the animal totally. So there's a lot of fat with the animal that's going into you. Reduce your unwanted, hidden fats from your processed foods, your packaged foods. You can eat natural fats like avocados, nuts and seeds in small amounts. That's when you want to cleanse your body. So kind of keep your fat intake minimal, your refined salt intake minimal. So you know when generally we talk about BP, it's always the salt. Namak kam kar do. It's not only the namak, it's a lot of other factors. Of course, namak, your refined salt plays a role. So from refined salt, move to pink salt. You know, hydrate your body well. Drink a lot of electrolyte-rich liquids like coconut water, lemon water. You know, your green juices. Your greens have a lot of minerals which can cleanse your liver. So the minute you start doing all this, your blood pressure will start dropping automatically. Eat your normal food, lot of fruits, your mangoes, bananas, grapes, melons. These are your liver-loving foods. They have the minerals, they have the fiber, they have the nutrients which your liver loves. So the blood doesn't have to work harder to pump the blood, which is so pure and so healthy, you know. So eat a lot of fruits. Of course, balance your stress. So these are a few tips which of course you can use, and of course exercising, being active, walking around, doing kind of an exercise which your body loves, which you enjoy, which is not again very stressful, which you don't have to be like, aaj meko jana hai exercise karne, oh my god, what a pain.
Yeah.
That shouldn't be the attitude towards your exercise. It should be something which makes you want to do it, you know. So that is what will help you to get your BP down.
One, if you had to sum up the stigma around BP in like a couple of sentences, how would you
Don't be fearful of it. It's only your body's sign telling you that there's something wrong with your digestive system, with your liver, and it's only telling you take care of it, give it some tender, loving care, and give it some, attention, and you'll be fine.
Like she said, you'll be fine, and I think that's all that we wanted to hear. You guys, you always ask us some really amazing questions, so we're hoping for more questions. So comment below and tell us if you have any, queries, anything that you want to ask her, follow her, and I'm sure she's going to get back and answer all your questions. Until next time, we're going to come with another episode and another theme, and with Neha, of course. See you next time.